In 40 days, the state's new Medicaid system, KanCare, will take over providing crucial services for people with developmental and intellectual disabilities. In a Kansas First News special report, Kevin Boughton tells us the state has made assurances that healthcare providers don't get paid if patient quality of life isn't good enough. But some families say they're worried the system won't be ready.
Marilyn Bittenbender's daughter, Laura, was diagnosed with an intellectual developmental disability at a young age.
And she's received support services in a special needs classroom from kindergarten on.
Now 36, Laura has a job at Cottonwood Incorporated in Lawrence, lives on her own, and a social life.
We couldn't be happier and more proud as a family of the strides that she's made.
Through every step of Laura's development and still today, Marilyn says her daughter is supported by a safety net made up of family, caseworkers, and support service providers who help her do things like pay bills or make a shopping list.
I have just been thrilled with the system that has been working very, very well.
Most of that progress has come here, working at Cottonwood, a community developmental disability organization, CDDO, where hundreds of people find work and get needed disability services.
We've accomplished so much over 40 years. To be able to have individuals with intellectual disabilities to be able to be a part of the community, to live in the community, to work in the community, and we want to see that continue.
It's been working pretty awesome from my perspective.
Now, Marilyn says she's worried what will happen to Laura's safety net when the KanCare system takes over IDD services January 1st.
The seamless transition is crucial for a very, very fragile population.
KanCare is made up of 3 managed care organizations: AmeriGroup, Sunflower State Health Plan, and United Healthcare. In separate statements to Kansas First News, AmeriGroup and United Healthcare both referenced a 180-day continuity of care period for IDD services that AmeriGroup said, quote, will help facilitate a smooth transition. United Healthcare said during that time, providers are paid at 100% of Medicaid rates. Department of Aging and Disability Services Secretary Sean Sullivan says the contracts between the state and the MCOs are written to ensure quality of life is a priority.
We think that one way to do that is to pay for those outcomes.
Meaning there are financial bonuses and penalties based on patient outcomes. An independent agency will make those assessments. Scott Brunner is a senior analyst for the politically neutral Kansas Health Institute.
And the outcome that the state has set in the contracts and all of the discussions over the last 2 years is we want to improve the quality of care that people receive in Medicaid. We want to improve access to care for people in Medicaid. So if those are the goals, then that's what you ought to measure, and that's what you ought to hold the MCOs accountable to.
Could motivation of large-scale savings mean at Laura's next annual care plan review, her MCO decides to cut services?
Then all of a sudden, a piece of the safety net falls away.
Case planning happens every year anyway, so it's not, that part's not unusual, but there's this new player of the MCO that'll be at the table too.
If a reduction is recommended, there is an appeals process.
Proposed changes would be reviewed and approved by us, and that'll be something that we take very seriously and something that we monitor very closely.
It's the first weeks and months of 2014 when KanCare implements developmental disability care that are critical.
We are concerned, cautious, but hopeful.
KanCare has made assurances that people can keep their same case manager. Marilyn says that person is most important when it comes to organizing the services that her daughter receives. As for potential delays in the billing process, there's a pilot program going on that is supposed to identify potential problems and then work to find solutions. Kevin Boughton, Kansas First News.